Hello everyone. Am I audible and visible to you? Okay. So, myself Dr. Shital Ghataliya, your faculty for Physiology. Welcome on the platform of Unacademy. I did MD Physiology from MP Shah Medical College and I am educating MBBS and MD students. I have teaching experience of more than 17 years and I am one of the experienced faculty for integrated curriculum teaching. Now, for the mock test, all India mock test is there, which is powered by Unacademy, which will be there on the 26th of Feb at 9 a.m. So you boost your medical PG preparation with the amazing subscription, which is valid from 7th to 9th February. With Plus subscription, you can have access to both live as well as recorded classes. You can learn from the topmost educators of India. India, you can compete in live tests and quizzes. You can study on the device of your own choice. You can have access to the question bank, having more than 25,000 questions in it. With iconic subscription, you can have access to the best from two of the best. Unacademy and Prepletts. With Unacademy, you will find various resources like well-structured live batches, recorded classes, question bank, and many more. Unacademy and Prepletts. With the Prepletts, you will find clinical and integrated essentials, video lectures from Dream Team, rapid revision and snapshot, and many more. Both are unique in its own way. Whatever is best suitable for you, that you can choose. These all are FMG toppers of December 2021. Congratulations to all the toppers from Unacademy. As I told you, there is an educator curated test series and study with me YouTube test series. Check with the date and time. With special class feature, now Unacademy came up with highly interactive live classes. There will be a poll for the learners. You can raise a hand and interact with your educator. You will never miss a class because Unacademy will send you regular notifications. Lecture notes are available with certain subscription. You can attend the classes from any time, anywhere. Updated, highly effective question bank is there. More than 25,000 high yield clinical questions are there, which are based on latest exam patterns, and it includes detailed explanation. Unacademy came up with raise a hand feature. Now you can be engaged with the quizzes, Viva, doubt solving, and many more. So there are two batches right now. NEET PG 2022 high yield MCQ marathon batch, duration 1 month, started from 9th of December. Sorry, 9th of February. Focus FMG 2022 comprehensive batch, 4-month duration, started from 9th of February. NEET PG 2022 image based question batch, 1 month duration. NEET PG 2022 ultra fast revision batch, 1 month duration. So you can target your next exam with target next integrated system wise batch from 2023. Iconic price drop is there. You can check with the duration and newer prices. Study with me pediatric test series is there with Dr. Anand. Live session will be there on 11th of February 10 p.m. Now come to the today's topic, that is platelets and its functions. So I told you repeatedly, in physiology, understanding the word is very, very important. Other name of the platelet is thrombocytes, right? Thrombocytes. So thrombo means clot. Cyte stands for cells. Means these are the cells which are responsible mainly. Main function is it plays important role in clotting. Okay, thrombocytes. These are colorless, non-nucleated, oval or spherical shaped disc-like structure. Okay, small 2 to 4 micrometer size oval or spherical shaped colorless non-nucleated structure. When we say non-nucleated structure, it means they can't reproduce, right? So, and normal platelet count in adult is 1.5 to 4 lakhs per mm cube. Okay. Thrombocyte means those cells which are responsible for mainly plays important role in clotting. They are non-nucleated, colorless, very small, 2 to 4 micrometer in diameter, oval or spherical shaped structures. They can't reproduce, right? And 1.5 to 4 lakh per cubic mm is normal value in adult. Okay, let us see the structure. See the structure of the platelet. Okay, see the cell membrane. This all we will be discussing. Okay, there is a thick coat below the cell membrane and cytoplasm which is non-nucleated. Right? Now, let us discuss the cell membrane first. Cell membrane is 6 mm thick, approximately 6 mm thick trilaminar membrane, cell membrane is there. In the cell membrane, there are various things like glycoprotein, phospholipids, glycoprotein, phospholipid, and there are canalicular system. Okay, there is a glycoprotein, phospholipid, and there is a canalicular system. Now, what these glycoprotein will do? Glycoprotein is important. It forms a coat. Glycoprotein forms a coat. Okay, it coat the platelet membrane. Okay, it will coat the platelet membrane and it will prevent the adhesion. Okay, prevent the adherence of the one platelet to the another one with the normal endothelium. Okay, prevent the stickiness. So with normal collagen, the one which is not injured, okay, it will prevent the adhesion of the platelet with the normal endothelial lining of the blood vessel. Okay, so but it will accelerate the adherence to the collagen and damaged endothelium. It will accelerate the adhesion to the collagen and damaged endothelium whenever there is a tissue injury. Okay, so glycoprotein is the one which will coat, it will coat the cell membrane. Okay, prevent the adhesion of the platelet with the endothelial lining of blood vessel. Okay, but when the blood vessel endothelial lining is damaged and collagen layer is exposed, okay, or if the endothelial lining itself is damaged, then it will promote the adhesion of the platelet with that. Okay, following injury, it will promote it. The another layer is phospholipid. It contains platelet factor 3. Okay, contains platelet factors 3 which plays important role in activating the certain clotting mechanisms. Okay, certain clotting mechanisms contains platelet factor 3 which plays activating role in certain points of clotting mechanism. So that is the important role of the phospholipid. Apart from that, there are invaginations. If you see, there are invaginations. You can see it here. See this one, this one. Okay, these are canalicular system. Okay, this is from the invagination of the cell membrane and forming the canalicular system. Okay, now come to the Another part of the cell membrane is it contains receptors. Cell membrane contains receptors which are meant for combining with specific substances, okay, which binds with the specific substances like collagen, fibrinogen, von Willebrand factor, von Willebrand's factor. Okay, short form is this VWF. Okay, so it contains receptor for binding with these specific substances: collagen, fibrinogen, von Willebrand factor. It also contains precursors. Cell membrane also contains precursors of certain substances like thromboxane A2, okay, different prostaglandins, leukotrienes, and platelet factor 3 and 4. So now if we conclude everything about the cell membrane is a trilaminar structure. There is a glycolipid which is coating the platelet membrane. It prevents the adhesion of the platelet with the endothelium of the blood vessel, right? So you can say in the circulation, the platelets are inactive. This is very, very important. In the circulation, platelets are inactive. It will get activated when it get exposed to the damaged endothelium. Okay. So glycolipid will help. Okay. It will help. Okay. Lipid sorry, glycoprotein will help. It will help in clotting, and it initially it will prevent the adhesion. Later on, if the endothelial cell lining is damaged, okay, or the collagen layer is exposed, okay, in that case the glycoprotein will promote the adhesion. Okay, so that is important function. Phospholipid will form a coat. Okay, it contains the protein. It contains the important factors, that is platelet factor 3. Okay, it is having a canalicular system. It contains receptors. Okay, receptors for various specific substances like collagen, fibrinogen, von Willebrand factor, and it also contains precursors of certain substances like thromboxane A2, prostaglandins, leukotrienes, platelet factor 3 and 4. So this is all about the cell membrane of the platelet. Now come to the microtubules part. What the microtubules does. Microtubules are made up of the polymerized protein. They are made up of a polymerized proteins that is called as tubulin. This is important. Microtubules are made up of a polymerized protein that is called as a tubulins. Okay, it forms a compact bundle. It will form compact bundle, okay, beneath the cell membrane of the platelet. Now you can see this here. Okay, beneath the cell membrane of the platelet, it will form a compact layer. Okay, compact bundle beneath the platelet membrane, which is responsible for maintaining the shape of the platelets. So it is responsible for maintaining the shape of platelets. Okay, so now if we conclude the overall structure, outer and inner structure beneath the cell membrane. In the cell membrane, there is a glycoprotein which prevents the adhesion of the platelet to normal endothelial lining, and it will promote it when the endothelial cell lining is damaged. Then phospholipids are there. There are receptors, okay, and it contains the precursors, right? Below it, there is a microtubules. These microtubules are forms a coat, and they are responsible for maintaining the shape of the platelets. Okay. Now come to the next one, that is a cytoplasm. Cytoplasm of the cells will contain endoplasmic reticulum, Okay, platelet cytoplasm contains endoplasmic reticulum, Golgi apparatus, few mitochondria, microtubules, and microfilaments. Contains microtubules and microfilaments, granules. This we will we will be discussing this granules. Okay, lysosomes. It contains lysosomes, enzymes, glycogen, and proteins. Okay, microtubules, microfilaments, granules, lysosomes, enzymes, glycogen, protein, endoplasmic reticulum, Golgi apparatus, mitochondria. Few mitochondria are there. Cytoplasm also contains, this is very, very important, it contains contractile protein. Okay, cytoplasm contains contractile protein, that is actin, myosin, and thrombasthenin. Okay, actin, myosin, and thrombasthenin. So they are responsible for the contraction of the platelet when it is attached with the injured tissue site. Okay, responsible for the platelet contraction. They are responsible for platelet contraction. So it helps in clot retraction. Okay, it helps in clot retraction. Following, once the temporary hemostatic plug is formed, it helps in clot retraction. Cytoplasm also contains the fibrin stabilizing factor, which stabilizes the fibrin when it is formed. Okay, it contains fibrin stabilizing factor. It also contains platelet derived growth factor. Understand the word carefully, platelet derived growth factor. Okay, so it causes the growth of vascular endothelial cells. It causes growth of the vascular endothelial cells and vascular smooth muscle cells. Okay, causes growth of the vascular endothelial cells and vascular smooth muscle cells and fibroblasts. Okay, so it plays important role in repair. See, the growth factor, name is self says growth factor. Okay, so it plays important role in repair of damaged blood vessel. Okay, so cytoplasm contains fibrin stabilizing factor, platelet derived growth factor, and von Willebrand factor. Okay, that is important for the platelet adhesion. Okay, so now if we conclude the substances which are present or the organelles which are present, microtubules, microfilaments, contractile protein, cell organelles are there, but in cytoplasm no nucleus is present. Okay, certain important substances like fibrin stabilizing factor, platelet derived growth factor is there. See, the word itself says it is important for the growth of the vascular endothelial cells and vascular smooth muscle cells and fibroblast. So, it plays important role in repair of damaged blood vessels. It also contains the von Willebrand factor. Von Willebrand factor is important for the platelet adhesion. Okay, and it also maintains the serum level of clotting factor 8. Okay, so that is important about it. Then it also contains the enzymes, various enzymes. Now, which are these enzymes? Adenosine triphosphatase. adenosine triphosphatase, an enzyme necessary for the synthesis of various prostaglandins. Okay, so prostaglandin will act as a local hormone and it will cause local vascular and tissue reactions. So enzymes for certain enzymes like adenosine triphosphatase and the enzymes necessary for the synthesis of prostaglandins are also present in the cytoplasm of the platelets. Now come to the granules. What the granules of the platelets contain. Okay, there are two types of granules. One is dense granules and another one is alpha granule. Dense granules and alpha granules. Dense granules will contain non-protein nitrogenous substances. It contains non-protein nitrogenous substances like phospholipids, cholesterol, okay, non-protein nitrogenous substances. Then apart from this, it contains 5-hydroxytryptamine, ADP, ATP and other adenine nucleotides. Okay, alpha granules contains clotting factors. Okay, clotting factors and platelet derived growth factor. Okay, it contains, this is important from MCQ point of view. Okay, dense granules contains non-protein nitrogenous substances like phospholipids, cholesterol, etc. It also contains 5-hydroxytryptamine, ADP, ATP, adenine nucleotides and such things are present. Okay, alpha granules contains clotting factor, platelet derived growth factor. Okay, now come to the, so this is all about the structural aspect of the platelet. Now come to the formation of the platelets, that is called as a thrombopoiesis. Okay, poiesis stands for formation, means formation of the thrombocytes, or other name is megakaryocytopoiesis, means formation of the megakaryocytes, or you can say thrombopoiesis. Now those stem cells which are diverted towards the platelet series. Okay, those stem cells, progenitor cells which are diverted to form the platelets, first it will form megakaryoblast. Blast cell will be formed, that is megakaryoblast. This megakaryoblast is 20 to 30 micrometer in diameter. Okay, and it can undergo endo reduplication. Okay, it can undergo endo reduplication of nuclear chromatin will be there. Okay, so it can divide. Okay, so that is the characteristic feature of megakaryoblast. Then eventually it will form promegakaryocyte. It will form promegakaryocyte. Okay, that contains basophilic granules. Okay, it contains basophilic granules. Then promegakaryocyte will cause formation of megakaryocyte. Megakaryocytes are the one which is irregular shaped and contains many platelets inside it. Okay, contains many platelets inside it. One megakaryocyte can form around 2000 to 4000 platelets. It can form 2000 to 4000 platelets. From megakaryocytes, the platelets will get pinched off. Okay, it will get pinched off. So, one megakaryocyte will form so many platelets, 2000 to 4000 platelets. Mature platelet which is present in the circulation, lifespan is 8 to 12 days. Okay, lifespan is 8 to 12 days. Different colony stimulating factors and thrombopoietin both will regulate the formation of the platelets, and site of destruction of the platelets is spleen. That is why whenever the spleen is enlarged, then it will trap more and more number of the platelets. Okay, so it causes more destruction of it. Okay. Now come to the variation. In which conditions? Physiological variations. Okay, in which conditions you will find variable number. Okay, so let us see the first one, that is age. Okay, platelet count is less in infants. It is less in infant, approximately 1 to 2 lakh per mm cube. 1 to 2 lakh per mm cube, and it will reach to the adult level by third month. Okay, by third month of age. Okay, after meal, platelet count increases. After exercise, platelet count increases, and at high altitude, platelet count increases. So that is the physiological variation. Apart from that, there are certain reasons which can cause increase or decrease in the platelet count. Thrombocytosis, okay, means increase in the platelet count. Okay, and thrombocytopenia, penia means decrease in the platelet count. Now let us see the reasons behind the thrombocytosis. After administration of injection of epinephrine, okay, you will find increase in the platelet count. In case of hemorrhage, trauma, parturition means after delivery, splenectomy means removal of the spleen, because the spleen is a site where platelets will be trapped and it will be removed from the circulation. So if spleen is removed, then splenectomy will cause increase in the platelet count, right? Then in case of stress, when the person undergoes stress, these all are the conditions which causes increase in the platelet count. Okay, now come to the thrombocytopenia, means decrease in the platelet count. Very important here is bone marrow depression. If bone marrow is depressed, then all the series will be compromised. So platelet series will also be compromised and it will cause thrombocytopenia. Okay, idiopathic thrombocytopenic purpura. Okay, purpura can occur because of the decrease in the platelet count. Idiopathic means where the reason is not known, right? So thrombocytopenia, which causes patchy hemorrhages over the skin and mucous membrane. So idiopathic thrombocytopenic purpura can also that can be a reason for thrombocytopenia. Then in case of enlargement of spleen. Okay, in case of enlargement of spleen, it will trap more and more number of platelets. So it will cause the removal of the platelets from the circulation. Certain infection, viral infections like smallpox, chickenpox, dengue fever, that is very typical, okay, in which you will find thrombocytopenia. Okay, smallpox, chickenpox, dengue fever. Here specifically you will find thrombocytopenia. Okay, then septicemia. In case of septicemia, toxemia, acute leukemia. Here what will happen, more and more series are diverted to form WBCs. Okay, so platelet series will be compromised. That's why there will be thrombocytopenia. Okay, in case of drug hypersensitivity reaction, thrombocytopenia will occur. So these are the different reasons of increase or decrease in the platelet count. Now come to the functions of the platelets. Functions of the platelet. One important function is hemostasis, like means formation of temporary hemostatic plug. Formation of temporary hemostatic plug. So here what will happen? Whenever there is a tissue injury, there are three steps which will occur, right? Which will physiological steps which will occur, which prevents the blood loss of the blood. Okay, so different steps of hemostasis are: the first one is vasoconstriction, second one is formation of temporary hemostatic plug, and third one is formation of definitive hemostatic plug. This definitive hemostatic plug, once it is formed, last there will be clot retraction. It will reduce the clot size, right? So see, whenever there is this is the site of injury. Okay, this is exposed or damaged endothelial cell lining and exposed collagen. So what will happen? Very first, it will cause vasoconstriction. It will cause vasoconstriction by local myogenic tone because of the release of 5-hydroxytryptamine. Okay, it will cause vasoconstriction of the blood vessels. So it will prevent the loss of the blood. So now the second thing, in the circulation, the platelets are inactive initially, right? Normally they are inactive, right? Now when the platelet, try to recall, on the cell membrane there is a glycoprotein. This glycoprotein will promote, okay, it will promote the attachment of the platelet at the site of injury, right? So glycoprotein will cause the promotes the platelet adhesion. Okay, it will promote the platelet adhesion. In the endothelial cell lining, there is a von Willebrand factor, and on the cell membrane of the platelets, there are receptors, right? Receptors for von Willebrand factor. So it helps in adhesion of the platelets at the site of injury, right? Von Willebrand factor is present in the endothelial cell lining of the blood vessel. Good evening, S. Verma. So von Willebrand factor is present in the endothelial cell lining of the blood vessel. Now when it is damaged, this is exposed, right? In the circulation, platelet cell membrane contains the receptor for von Willebrand factor. Plus glycoprotein is there, which is promoting the attachment of the platelet at the injured site, right? So by this way, it will adhere. Once it will adhere, it will become irregular. Irregular in shape. It will send out the pseudopods and it will become irregular in shape, and it will discharge its granular content. Okay, it will discharge the granular content, that is ADP, thromboxane A2 will be formed, right? So it causes the formation of thromboxane A2 and ADP. Okay, so a change in the shape and discharge of these granular content. Okay, so what it will do? First thing which will happen is a platelet adhesion. First is platelet adhesion. Okay, sorry, activation followed by adhesion, right? Then third one is aggregation. Now once the platelet adhere and it releases the granular content of it, it will attract more and more platelets at the site of injury. Okay, thromboxane A2, it is having a platelet aggregating effect. So it will attract more and more platelets at the site of injury. So platelet aggregation will causes the formation of temporary hemostatic plug. It will cause the formation of temporary hemostatic plug, which will plug the injured site and prevent the loss of blood, right? So this way, it plays very important role in formation of temporary hemostatic plug. So if we recall it quickly, first there will be platelet activation. In the circulation, platelets are inactive. It will get activated when they are exposed to the rough endothelial lining. In the endothelial cell lining, there are von Willebrand factor and receptors for von Willebrand factors are there on the platelet cell membrane. Okay, it will promote the platelet adhesion, right? Once the platelet adhere, okay, it causes change in the shape, it discharges its granular content, okay, discharge its granular content, and it will attract more and more platelets at the site of injury. So the third step is platelet aggregation, platelet activation, adhesion, and platelet aggregation. Okay, so this way it will cause the sorry, I there is a sequence is wrong here. Platelet adhesion is first, followed by platelet activation, and platelet aggregation will be there. First it will adhere, then it will get activated, and then it will cause platelet aggregation. Okay, now the second thing is plate deformation of the definitive hemostatic plug. Once the temporary hemostatic plug is formed, okay, I would like to repeat this part. I would like to repeat this part. First one is in the circulation, as I told you, platelets are inactive. Okay, when it get exposed to the endothelial cell lining, it will get adhere. So platelet adhesion is first, then it will cause activation of the platelets. It will change the shape. It will discharge its granular content. Okay, and then it will cause granular content, that is ADP, and it also causes formation of thromboxane A2 and prostacyclins. Okay, so discharges its granular content. Once the granular content are released, it will cause attraction of more and more platelets at the site of injury, causes platelet aggregation. Okay, so this way the sequence will go: adhesion, activation, and aggregation. Okay, so it will plug the injured site and it will cause prevents the further loss of the blood. Then formation of the definitive hemostatic plug. Platelet also plays important key role at various steps in the pathway of the clotting mechanism, okay, and helps in formation of the definitive hemostatic plug. Then clot retraction. As I told you, in the cytoplasm there are contractile protein, actin, myosin, thrombo, asthenin. Okay, these are contractile proteins, so it will contract and reduces the size of the platelet. Okay, and once the clot is formed, platelet contraction overall causes decrease in the clot size, that is called as a clot retraction. Then storage of 5-hydroxytryptamine and histamine. When the platelet passes through the GI tract, it can take the 5-hydroxytryptamine. Okay, against the concentration gradient, it can take it. Okay, and it can store it inside it. And that this one will be transported and it will be released at the site of injury. It will be released at the site of injury. Then phagocytic function. It can phagocytize the larger particles, antigen antibody complex. So it plays very important role in defense mechanism. It also helps in the repair of the blood vessels that I told you. It helps in the repair of the blood vessels. Contains the platelet derived growth factor, right? So it plays important role in repair of blood vessels. So this is all about platelet. If you have any question, you can ask me. Okay. So let us have a very quick overview of this entire topic. Okay. Platelets means thrombocytes, clot forming cells, right? So it is also called as a thrombocytes, platelets or thrombocytes. They are non-nucleated cells, colorless. Adult value, normal value is 1.5 to 4 lakhs per mm cube. This is the structure. If you look at the cell membrane, it contains glycoprotein. Glycoprotein forms a coat that prevents the adhesion of the platelet to the endothelial cell lining. This is very important. So in the circulation, platelets are inactive. Okay. Then once there is an injury and collagen or endothelial cell lining is disrupted, then it will promote the adhesion of it. Okay. Platelet phospholipids are there. It contains canalicular system. It contains microtubules which forms the inner coat. Okay, microtubules which are formed of the protein tubulins. Okay, forms the inner coat, maintains the shape of the platelets. Cytoplasm contains the various organelles. It also it also contains fibrin stabilizing factor, platelet derived growth factor, and von Willebrand factor. Remember this, platelet derived growth factor is important for the repair of the damaged blood vessels. Okay. Then dense granules and alpha granules are there. Dense granules contains non-protein nitrogenous substance, 5-hydroxytryptamine, ADP, ATP, adenine nucleotides, and alpha granules contains clotting factors and platelet derived growth factor. Progenitor cells, from the progenitor cells to formation of the mature platelet, okay, it takes 8 to 12 days. And from one megakaryocyte, there will be approximately 2000 to 4000 platelets can be formed. Okay, once from the megakaryocyte, it will pinch off the platelets. Okay, many platelets. Okay, so that is important. Then in infant, platelet count is less. It will reach to the adult value by 3rd month of age. Various viral infection, this is very, very important. Viral infection causes thrombocytopenia. Smallpox, chickenpox, dengue fever, these all can cause thrombocytopenia. Removal of the spleen causes thrombocytosis, right? Thrombocytosis, because spleen is responsible for the removal of the platelets from the circulation. If the spleen is enlarged, hypersplenism will cause thrombocytopenia because it will trap more and more platelets from the circulation. Then important functions of it: formation of temporary hemostatic plug. The following tissue injury, there will be platelet adhesion at the site of the injury. It will cause activation, change in the shape and granules, release of the granular content of the platelets, and finally there will be platelet aggregation, adhesion, activation, and platelet aggregation. Then role in a definitive hemostatic plug, because it plays very important role at certain steps of the clotting pathway. It contains contractile protein, actin, myosin, and thromboasthenin. Okay, so it causes the contraction of the platelet, reduces the size of clot. It stores the 5-hydroxytryptamine and histamine. It is also having phagocytic function. It can engulf the antigen antibody complexes, and it plays important role in the repair of the blood vessel. Okay, so this is all about the platelets. So I hope all of you understood everything. Study hard, study with us, study with me. Subscribe Unacademy Future Doctor channel and help us to reach to more and more number of students.